so a Silicon Valley venture capitalist dropped the word. One doesn't hear every day, data quake. We're going to look back at 2018, 2019. He says, those were the years of the data quake, said John Doerr, Chairman Kleiner Perkins, Caulfield and Byers. Data was required to be interoperable. Innovators came together to move us to an app economy. So they're starting to paint this vision of the data's getting to such a place that we're going to start to see things like like an Apple App Store for health apps. So let me hit a couple of the key things on this. So Administrator Seema Verma urged health insurance companies to follow the center's CMS lead to make claims data more readily available. She says, we're at the beginning of the digital health revolution. We have the ability to take that data and unleash it. She said during the Blue Button conference, we're unleashing the most powerful force in our economy, the consumer. Verma added that CMS is creating a new type of patient profile by making the agency's massive amounts of claims data available to the public via Blue Button 2.0. And she said, we're not stopping there. We're leading by example and calling on all insurers to release data in an API format, Verma said. You'll see through our regulatory process that we're very serious about that. They talk about not only releasing the CMS claims data, they talk about encouraging payers to release their data. More than 600 developers signed up for Blue Button 2.0 to start experimenting. I think that number's up over 700 now. And that which will give them access to, the developers can build integrations across more than 4 years of Medicare Part A, B, D data for 53 million Medicare beneficiaries. And if that wasn't enough, you had Amazon, Google, IBM, Microsoft, Oracle, Salesforce pledge to remove interoperability barriers. So in terms of just visioning, big day for them, just laying out this vision for freeing that healthcare data, putting it in the hands of developers and clinicians to really rethink how we use the data. And so they're putting it out there. So let's just start with, let's riff on this vision a little bit. So does the data have the ability to change healthcare as it has in just about every other industry, or are we going to see some barriers?
Absolutely. First of all, great news, great article. And I think one of the other people quoted in the article, Hemant Taneja, said something about consumerization, and I absolutely agree with that. Yeah. A consumer-like ecosystem. And I think that the shift have been slow. It's been happening for a while. And truly, I think it's a matter of when, not if, right? And there are many reasons to believe that now is the time, okay? And there are many reasons to liberate the data. First is direct patient care. The ability for patients and provider to access relevant data regardless of direct access to EMR. There's a lot of good work being done in the name of interoperability, which needs to continue, all right? And I absolutely believe, to your point, that data in the hands of researchers and developers and entrepreneurs will truly change the way we provide healthcare. There is a ton of data in EMRs and other clinical systems which is not used. Overwhelming majority of it just sits there for legal or compliance or historical reasons. And this is the data that in the hands of entrepreneurs in research community can do wonders. Now, you asked about barriers. Yes, there are barriers. First, we have to think through privacy implication. For instance, companies like Apple are not covered by HIPAA, right? And there is a level of expectation from consumers, patients, about the safety. For the last 20 years, we have told everyone that your patient information is covered by HIPAA and so forth. These third parties don't have those protections, I guess, right? So we have to just think through it. Doesn't mean that it should not be open. I'm all for opening. It's just that we have to think about the implications of making sure that patient data is protected. There are really real technical barriers to interoperability and openness. And as an industry, we have been trying to solve those for many years. There have been many successes. This conference was Blue Button 2.0. There was 1.0. So there are a lot of lessons learned, and there are going to be more lessons learned. I think the time is right. We need some push from our policymakers. We need engagement from organizations like Google and Microsoft who have the resources to make things happen. And I think researchers will do their job. And good things will come, similar to app economy that we saw in last decade.